Okay, we're going to get started. Good afternoon, everyone, and welcome to today's session, Launching iPEP, an industry partnership to improve patient and family education. My name is Joanne Clavel, and I'm the Regional Vice President and Chief Nursing Officer for the West for GetWell Network. During this afternoon's sessions, our presenters from Legacy Health and Concordia University in Portland, Oregon, will share how they developed and implemented iPEP, an innovative academic practice partnership that engages patients, families, nursing students, and clinicians to reinforce care decisions and prepare for hospital discharge. They will share their experiences developing and implementing iPEP and the results of their dynamic partnership. It is my pleasure to introduce our co-presenters, Nellie Crawford and Ashley Bogdan. Nellie Crawford received her bachelor's in nursing from Linfield College and began her career at Legacy Health in acute care pediatric oncology. In this role, she discovered her passion for education and worked as a simulation specialist. She received her master's degree in nursing education from Western Governors University. Most recently, Nellie has served as patient education specialist for Legacy Health, overseeing patient education content with a focus on making sure that it's delivered to patients and families in the most meaningful way possible. Ashley Bogdan received her undergraduate degree from Kansas State University in Family Studies and Human Services and dual majored in gerontology with an emphasis on long-term care administration. She joined the Concordia team in June of 2019 as the clinical placement coordinator, where she implements and evaluates strategic partnerships and clinical placements for students and ensures agency-specific compliance requirements. After hearing from our presenters, we will open the floor to see if you have any questions. But before we get started, I need to share a disclosure statement with you from the Maryland Nurses Association. The Maryland Nurses Association is an accredited approver of continuing nursing education by the American Nurses Credentialing Center's Commission on Accreditation. If you wish to receive credit for attending this activity, you must complete the session survey found on your conference mobile app. In the survey, it's important that you check the box indicating that you'd like to receive credit and enter your full name and email address in the space provided. Your certificate will then be sent to that address. In compliance with the Continuing Education Activity Credit Conflict of Interest disclosure requirements, we'd like to announce that the presenters of this session have no commercial association that would create a conflict of interest. Thank you again for coming. I will now turn this over to Nellie Crawford, who will kick off our session.
Thank you very much, Joanne. That was a very warm welcome. And thank you all for being here this afternoon. We kind of got the hard part of the day on the last day of the conference in the afternoon. So we really appreciate you coming. We are here to talk to you about a program we designed between a health system and a university. Before I get started, I want you to imagine with me for just a few moments that you're a nursing student. And I guess a show of hands, how many nurses do we have in the room? Most of you. So for you, remember back to that first day when you entered a patient room for the first time in your new role. For those of you that aren't nursing, imagine that you are. Imagine that you are in your clinical rotation for your first in-hospital experience with patient care, and you're going to be working on a medical surgical unit. Last night, you went to the hospital. Sorry, I hate standing in front of mics. I keep wanting to run away from it. Last night, you went to the hospital unit, and you picked out a patient or two. You went home, and you spent hours researching the patient's medical history, what brought them into the hospital for this visit, and the medications that you're going to be giving tomorrow. Right now, you have your hand on the door of that room, and you're about to walk in. And what's running through your mind, along with a prayer, is a list of 20 different tasks that you need to complete in the next 10 to 15 minutes with that patient. You push open the door, you greet the patient and their family, and you tell the patient what you're going to do next. And as you get ready to take their vital signs and their head-to-toe assessment that you have practiced over numerous hours in a clinical lab in the last month, you take off your stethoscope and you think, please don't let there be abnormal lung sounds, because I'm really not sure the difference between rhonchi and rales. And if you're a nurse, you know what I'm talking about. And dear God, please let everything be normal. Now, I want you to step outside of that room and get ready to re-enter. Only this time, as your student nurse walking into this patient room, you received an assignment of a few patients that you're going to see during the day today, and your focus is to listen, to learn how to introduce yourself, and learn how to hear what the patient is actually saying to you. You walk into that room, you take a deep breath, you introduce yourself, and you sit down and have a conversation. So we are here today to talk with you about iPEP. It's an interactive patient education program that we designed to take some of the burden of patient education and navigating GetWell Network off of the nurses' shoulders in our hospital system. To give the student nurse a foundation in patient education and to begin learning the art of a healing presence. And for our patients to just get that much needed voice where they can talk to somebody about what's going on with them in that day and in that moment. So I work with Legacy Health System. We have 8 hospitals in our health system. We're located in Portland, Oregon, and Southwest Washington. Our 8 hospitals include a psychiatric hospital, a children's hospital, the Oregon Burn Center. We have all levels of care and just about every discipline that you can imagine, we service. Our journey with GetWell Network began in 2012 with the opening of our children's hospital. At that time, GetWell Network was implemented mainly as an entertainment system. By 2015, we had developed our health videos and integrated iPEP with that to order those videos and to have that document back into iPEP when the videos were watched. Over the next 2 years, we rolled out an additional 4 hospital sites, so we actually have 5 hospitals live with GetWell Network at this moment, and our 6th hospital will be going live this June. A year and a half ago, I stepped into a newly defined role at our health system as a patient education specialist, and my job is to oversee patient education content in our system, what we create within our system, and what we bring in from outside our hospital system. I also am responsible for our patient experience with that content. And one of the programs entrusted to me is GetWell Network. As I explored GetWell Network and dug into the utilization, I found that for our adult hospital sites, our patients have an average of 3 to 5 videos assigned per patient. In our children's hospital, they have an average of 2 videos assigned per patient. On this graph, you'll see our utilization of health videos over a year period of time. When I talk about utilization, I'm not talking about the number of videos assigned to our patients. I'm talking about the number of videos, health videos that were assigned that were actually watched. You'll see these numbers are really low. Although we assign a lot of videos, most of those videos are auto-assigned on admit into the hospital. I do not include our introductory or mandatory videos in that count. Of our 5 hospitals live with GetWell Network, we ranged between 5 and 28% of our health videos actually being watched in our system. So why was this? I went out to our hospital sites, I went into our units, I talked to our staff, and I talked to our patients. From our patients, I learned that no one really orients them to the system, and a lot of them have trouble navigating the system on their own. When I talked to our nurses, I discovered that of the ones that had been excited about GetWell Network, it really got pushed to the bottom. One nurse said to me, "Nellie, with everything I have to do in my day, with all the tests that I have to complete, and as quickly as I need to get patients out the door and get new patients in the door, we educate, we do what we need to do, but this is fluff, and I don't have time to add it into my day." The responsibility for GetWell Network at our hospital system laid solely on our nursing shoulders. We had to change that. And we had to increase engagement. We had to increase engagement for our nurses to engage our patients and our patients to engage with the system. But in order to do that, we had to show the value of the system. I had the opportunity during this time period to talk to some other GetWell Network sites around the nation who had higher utilization of health videos watched. And one thing that I discovered is that those hospital sites train all of their staff who engage with patient care to be able to navigate the system. One hospital in particular in Florida that I talked to told me that they were a teaching hospital, and they utilized their students to orient their patients to GetWell Network. And that was my light bulb moment, because we too at Legacy Health, we're a teaching hospital. And I thought, we have students, why are we not using them? I went back to my hospital site and had some conversations so that we could capitalize on this idea and partner with one of our existing relationships with Concordia University.
Okay, so that's where we came into play at Concordia. Nellie approached our Concordia administrative leadership team with this idea, and it was met with enthusiasm. From there, our Concordia administration and Legacy's leadership came together and created a design team. That design team consisted of Legacy's GetWell Network educators, our Concordia Director of Nursing Academic Services, nurse educators, nurse staff, and sorry, I gotta look at my notes for a moment. It all came together just to create the early development of the iPEP program.
So our program development took place over a month in 2 separate meetings where we visioned what our program would look like in 2 years. From there, we developed our objectives and the roadmap to guide us to meet those goals, or to meet those goals. Sorry. We also came up with our peppy name, iPEP. We wanted it to be catchy, and we wanted people to remember it. So what was our outcome goals that we wanted to achieve? Well, we wanted our student nurses to have that foundation in patient education. We wanted them to learn the art of being a healing presence. And we also wanted to graduate a workforce coming into our health system that had an understanding of technology and how to use that in patient education, using multimodal resources. For our nursing staff, we wanted to give them support in delivering that education, support in orienting their patients to GetWell Network. We also wanted them to know that GetWell Network is not just health videos. We always say that we really underplay the entertainment portion and the relaxation portion for that engagement of patient care is so critical to a stay in a hospital. Our pediatric ICU had numerous complaints when Frozen came off of the list, Frozen came off the list because they were giving reduced sedation medications during painful procedures when their patients were watching Frozen. We know that for dementia and Alzheimer's patients, their stress level and anxiety levels greatly reduce during inpatient stays when they're listening to relaxation music and videos. Our patients were not accessing these, our elderly patients especially, because they simply didn't know it was there. We're also really hopeful that the students' excitement about using technology would invigorate some of our nursing staff and show them some of the resources they had in their back pocket that they didn't understand.
Next slide.
Did I cover it?
Yep, we're good. Okay, so the course curriculum itself to develop this program didn't change. What actually changed was a transformation in the thinking process of how our course objectives could be met by doing patient education in this manner. So we had existing course objectives that we used to tailor the iPEP experience around. And what needed to change was the clinical instructors, the students' way of thinking, and seeing that they can still access the critical thinking portion as they're doing patient assessments on the charts and engaging with the patients and their families. And the students act as extensions of the bedside nurse. They're not autonomous. They go to the bedside nurse and ask, is this module, this video appropriate for your patient? And they run everything through them. To get the word out to all of the units where our students were going to be on, this is one of the tools we developed. It shows the course objectives as well as some goals for the program. Just a little background on this clinical. It is the student's first semester in acute care setting. It is 8 weeks long. They work the full 12-hour shift. For the fall semester, we had one clinical instructor assigned to 8 students, and then 6 of those students were in the traditional hands-on technical skills with the patients, and then 2 of them were in the iPEP, where they would go and do patient education in pairs. We had the clinical instructor manage the students, and they would plan how the students would rotate between the traditional and how they would rotate out into the iPEP patient education.
So this was our staff flyer created to give nurses an understanding of what the students would be doing in their iPEP role. Their role was defined differently than a traditional nursing student. They wouldn't be doing actual hands-on technical nursing cares with the patient. The student, when they came on shift, would receive an assignment from their instructor. They would then go do a quick scrub down of the chart, patient diagnosis, medications, patient education that they had, review the learning readiness assessment if it was done on admit. And then they would check in with the patients on their list and schedule a time to come review patient education with them during the day. They would check in with the nurses to see what other items they might go over with their patients that day, such as first dose medication teaching, if there was a handout, a patient handout that they could give and go over with that patient for medication. Remember that these students are in their hospital experience for the first time, and so while we have them review education with the patient or listen to educational videos, the students were not responsible for teach back. And so we made sure to let the nurses know that they still had that responsibility. Just as if the patient read a handout or watched a health video, the nurse still needed to go back and do that teach back portion. The great thing about having the student in the room is they could then go into Epic and document any handouts that were given to the patient and reviewed, and the level of understanding as stated by the patient. And then for health videos, they could help patients complete that video or that question that is at the beginning and end of the video that allows it to document back to EPIC. The students also completed the learning readiness assessment in EPIC if it was not done on admit, which I hate to say this, but we're very bad at completing those on admission in our hospital system. So the nurses were super excited to have the students do that for them. The students could also just simply sit in a room and just be there for up to 20 to 30 minutes with a patient. They would listen to the patient, find out what patient needs were. Sometimes the student might just play that relaxation video or music for the patient in the room. The instructor was responsible to go to the charge nurse and get patient assignments for the day on different units. Another unique role to these students is they were not assigned to one specific unit, but they could go to different units throughout the hospital and see patients. The instructor would give the charge nurse a pager number so that if admits came to the unit that they could call and a student would come and orient those new patients to GetWell Network. And then this instructor had responsibility at the end of the student visit to triage that visit, and I'll talk a little bit more about that in just a minute. Before the clinical actually started, and our first clinical started the end of September, we had some work to do. We developed orientation for the nursing students to GetWell Network. They did a learning module, and then they did hands-on training with me. The instructors had a learning module and a hands-on learning day as well. We developed field guides for the student during their day. So they had GetWell Network tips and tricks, how to approach a patient, questions they could ask a patient. We also had some scripts for health videos, some questions they could ask the patient about their learning for that specific video. We wanted them to be able to contact help in the moment. So if they're in the room and something in the GetWell Network system isn't working, we wanted them to have those numbers of how to get the 1-800 helpline for GetWell Network and how to orient through the hospital. So we'd have hospital maps, and we have a patient education site on our intranet, and I just listed all those resources for them as well. We also had a survey that I placed on there, and Ashley will talk about that in a moment, that when they came out of the room, they could do a quick survey on their patient visit. These are a couple of advertisements we used internally with our system. So the 2 months before our first clinical actually started, we went to all 5 of our hospital site leadership. We went to our nurse executives, we went to manager meetings, we went to charge nurse meetings to spread the word. The week before the clinical started, it was close to Halloween, and so we took black cauldrons filled with candy and this flyer to all the nursing units to get the nurses' attention about the clinical experience coming to them. As I said, we use these advertisements. One is internal, intended to go out to all staff, and then the second one was specifically targeting our nurses. During the clinical, myself and Concordia University leadership were in really close contact with the students, their instructors, and with nursing staff and their managers to find out how the program was going and if there were any adjustments that needed to be made in the moment. We also checked in on how data collection was going along the way, and then sent surveys out to our nursing staff and managers to get their feedback on the clinical experience, and we'll share more about that. This is the SBAR form that we created. An SBAR, if you're non-nursing, is a formal communication guide so that you can get information in a concise manner to the person reading this. You'll notice that this is identical top to bottom. So if you're a nurse, you also know that if a student's in a room talking with a patient, they are going to come out of that room with a list of 40 things that they learned and they are so excited to share with you. We did not want that data dump landing on the nurse's shoulders. So the students would come out of that room, fill out their survey, which was through Rounds Plus. You'll see that in just a minute. Then they would fill out the top part of this form in an SBAR format, call their clinical instructor, and triage this through their clinical instructor. The clinical instructor would take any critical information with the student directly to that bedside nurse. So that patient is having chest pain, but they don't want to tell anybody because they know that means they can't go home today. Or that patient's getting ready to go home and they confess that they really can't pay for those necessary medications they need. That went straight to the nurse. The student could then document the EPIC and the visit in EPIC. They can resource out to ancillary departments, so maybe a message needed to go to physical therapy about the patient. They can send a message to dietary. They can get a message to financial or chaplain services. All of that gets documented in EPIC for the nurses, which our nurses really, really appreciated. And then the bottom portion of this form, they would refill out with their instructor's guidance, and that would either be given verbally to the bedside nurse or left in the unit where the bedside nurse could find that. And however that closed loop communication happened was unit dependent on their preference.
As Nellie mentioned, after the students left the patient visit, they would fill out a quick survey, and we utilized the GetWell Rounds Plus tool. The survey consisted of questions that didn't contain any patient identifiers, but mostly focused on whether or not the patient was receptive to the education that they were given and what mode the education was used, whether it was a handout or a video on the health GetWell system. That's what they documented.
So now we have some data slides. How did we do? First of all, I'll tell you on these slides, you'll see 3 months, the month of September, October, and November. Our students started their clinical the end of September, and they were in orientation. Our iPEP students were fully up and functioning in the month of October and the first 2 weeks into November. Now remember, we have 2 to 4 students once a week at each hospital site during our iPEP program. Across the board in all of our sites in the month of October, the number of health videos completed went up, except for one site. And in that hospital site, we had low buy-in into the program, and we'll talk about that more in just a minute as well. The interesting thing on this slide is, although the students were just there 2 weeks in November, our health utilization, our health videos completed actually continued and an increase prior to September. This slide shows the number of videos assigned in the month of October and November while iPEP students were functioning. The reason I showed this is because our patients get a lot of videos assigned to them automatically, but we saw an increase in assignment during the iPEP program. And the importance of this to our health system is we are set up so if a video is assigned inpatient, it's able to follow our patient in their patient portal as an outpatient. So maybe I'm newly diagnosed with diabetes and I have tons of information coming at me, just the word diabetes. I have to learn how to give myself insulin and check my blood sugar 3 or 4 times a day and eat differently than I ever did before, and what to do on a sick day. Well, if the video is assigned, 6 months later at home, they get sick. Now's when that information is important to them and they can go in and watch that video. And so it's really important to us, not only do they watch it, watch the key content in hospital, but they have those resources at home later. Now I'm going to drill you down to one specific hospital. It's our children's hospital, and 2 specific units. So the green bar represents the number of patients, the blue bar is the number of health videos assigned, and the yellow bar is the number of health videos watched. On this unit, we did not have iPEP students, and very interesting, their number of videos watched during the month of October declined. This next slide shows what happened across our hospital sites in individual units with iPEP students, but this is a picture of just one snapshot. And here you'll see in the month of October, the videos completed increased from September and had a continued increase into November.
One thing to note about Concordia is that we did see an increase in our exam scores for students who had participated in the iPEP program. They also reported higher levels of confidence as they reviewed charts, and higher levels of confidence when they just walked in and introduced themselves to the patients and had conversations with them and their families. And this slide, we talk about all the lessons we learned in the first semester. Like Nellie mentioned, we had a lot of things that we implemented that we had to kind of modify in the moment throughout the course of the semester, and then even look at changing it around for this spring. So there was a lot of lessons learned. As you all know, like, something looks really good on paper, and then you try to implement it into reality, and it's like, nope. So one of the things that we changed around for this spring is that we had a clinical instructor that was dedicated solely to iPEP students. So instead of 2 students in a group of 8 that are iPEP, it was a full group to 6 to 8 students that are doing patient education on the units. And we also just needed better buy-in from our clinical instructors and our students to understand the expectations for this role, and how their course objectives could be met.
So a lot of feedback from instructor and students included that they felt it was difficult to take time away from what they needed to learn in that medical surgical experience for patient education. That's why the change of philosophy is so important. I always say that in nursing, if our heart is caring, our soul has to be education. And education has to be foundational into our workflow, and it has to fit the patient need. So getting the students and instructors to come around and seeing the value of this program was really key, and something we really had not anticipated initially. The other piece we really didn't anticipate initially is nurse resistance. When we talked to the nurses about the program, they were super excited. They thought this was wonderful. But when students came to get assignments for the day, the nurses would often say to them, well, my patient doesn't really know you, and so they're not going to have any buy-in for the education you provide. Or, my patient has dementia, my patient's homeless. Lots and lots of excuses for why the student should not visit. So a couple things we did differently this year, in addition to giving the iPEP students their own clinical instructor, and they do 4 weeks of traditional and 4 weeks of the iPEP program in their 8-week-long clinical. I lost my train of thought there for just a second. So we gave them their own clinical instructor. I also set it up for the clinical instructor to not only check in with the charge nurses, but also to check in with our case managers of specific disciplines. So we have a lot of pre-assigned videos. Our heart failure patients, our stroke patients, our asthma patients, and our diabetic patients have pre-assigned videos that our students can go in and watch these with the patients without having to get nurse permission to go in. They let the nurse know that they're going to go see these patients during the day. And this is not that different from our case managers popping in and doing education with those patients. I think that's everything. Thank you so much. We do have time for questions, but before that, I just wanted you to know that if you have any questions, we are happy to share any of our program pieces that we developed with anybody. One of the great things about this program is that we want this to grow. We partnered with Concordia University. We're spending a year getting the program set. We're seeing what works and what doesn't. We're in our 2nd term right now, right in the middle of it. We're working out all the little details, and then we want to take this to the other nursing schools in our area. one wonderful thing about our area is we don't have a shortage of nurses. We're inundated with nursing schools. So we can have a lot of help coming into our hospital system.
Great.
Questions?
Yeah. Does anybody have a question? Oh, there she is.
So I know I'm with GetWell. I'm in product, so this might be a biased question, and maybe we could talk after. But all of this work you do to get people to adapt the technology, right? Like from a product perspective, I'm like, how can I make the tool intuitive and like people love it and use it? And yet there's like all this other process around it, right? Like to some degree, like even if the tool's awesome, like you guys have a lot of work. So do you have to do this with like all the tech you use? Like are there things that we could do to sort of help you spread the gospel the way that you're having to spread it? She's like, let me get back to you. I have a list. I get it.
I think that there is a lot of partnership that we could do to help spread this. I think you're talking more about, if I'm hearing you correctly, more about making it more intuitive to be able to just access versus somebody having to go in and orient and navigate for the patient. Is that?
Can we like help you with additional training? Like all the one-pagers you showed, those are amazing. I hate that you have to do it in order to get people to use it. Like, are there ways that we can adjust our tooling to make it easier for people, right? Like encourage them to use it without having to do all these flyers. Or are these flyers necessary, you think?
So one of the things that I'm doing right now is doing a feature of the month with our nurses. So yeah, if you guys could put out these exciting details of what's in GetWell Network, that would be great. Our steering committee is doing, like I said, feature of the month, and the month of January was a big flyer that said, hey, do you know you can do relaxation videos with your patients, and 2 or 3 bullets of why that's so important to your patients and how that's helpful, and just a screenshot of how they can access that for their patients really quickly.
That's awesome. Yeah, great. Done.
But yeah,
Well,
let's
I can't
talk.
really say done, but that would be Luann, but I will send her the message.
We've got one question over here.
Honestly, you bring up a great point. We all learn differently. So having a multimodal approach to teaching or education is always a wonderful thing. Right there.
It sounds like you're expanding the use of nursing students, expanding from 2 weeks to 4. My question is, are you looking or planning to look at how on those units, since you mentioned that you can track the clients in the post-discharge period, if any of those metrics are being affected, like less readmissions, less post-surgical complications?
So I don't have a great way right now to track the patients that received education with whether or not they're readmitted for our hospital system. However, having said that, at one of our hospital sites, we, in the months of November, December, saw high readmission rates with our heart failure patients. And so they actually called me in January and they said, the unit that most of our heart failure patients are on, and they said, Nellie, we're having all these readmits, and as case managers, we realize that we must be falling down on the job with our education, and we want to talk to you about GetWell Network and how we can leverage GetWell Network with every single one of our patients so we can track readmission rates. And so I think that's really the way I'm going to have to go about it for now, is I will get data with our nursing students doing really focused education for heart failure patients and look and see what the heart failure readmission trend does.
Oh. Hi, thank you for your presentation. It's really, really amazing, all the work that you guys have done. I'm curious, because so many of our clients aren't teaching hospitals, if you think that there's a way for us to modify what you guys have done here for volunteers, and if you've had any thoughts on how you would do that. I think that would be super useful for other clients that don't have the students as participants.
Absolutely. The idea started with training our volunteers to help orient our patients to GetWell Network. although volunteers come and go, and sometimes to really go into the health education piece, it's hard to get volunteers that really can learn that aspect of GetWell Network and sitting through a video with a patient. A lot of our volunteers are elderly, and they too have difficulty navigating through the system. And that's one reason why having the students is so wonderful, because not only are they for the most part young, but technology is ingrained into their brains, right? Like, it's not for our elderly. It's not an intuitive thing for them. When I originally approached Concordia, the model in my head was to essentially have the nursing students act in a volunteer role. And it just expanded. In fact, last fall, the director of student nurses for Concordia looked at me and she's like, "Did you have any idea that it would totally reshape our program?" And it was like, no, I thought we were going to be using them as volunteers, right? Not totally implanting education into the nursing program. I mean, it was already there, but how the students utilize education. I already have a lot of tools developed for a volunteer role in this manner, and I'm happy to share it. Yeah.
So following up on my colleague Jess's question, she probably was asking, I saw her sort of smiling, that it was about the same. I wanted to hear exactly what you might have for materials that you're giving those volunteers, because that's one of those places that maybe that's something we can build into the tool, that you have a onboarding for a volunteer of how to use our software.
So I have a instruction sheet of their role as a volunteer. I also have one for the role of the student, not using hands-on technical skills with patients. And I have a module designed for the volunteer. I typically, with our volunteers, I go and meet with them and just go over the basics of GetWell Network, because they don't need the in-depth piece of how the education track works, but how to just navigate in those music tiles and service tiles that are so key for patients. And then if I can, I get a volunteer to kind of own it, and then they teach it as new volunteers come in.
That's great, by the way.
Did you?
Utilizing them to teach others, I like that.
Yeah.
It's a great approach.
Sorry, we have lots of questions from GetWell. But I'm going to be selfish. So I got to visit Legacy in Portland a couple weeks ago, and I've worked with Legacy before in the past life. One of the things that I have seen as I've done a little bit of rounding with some of our clients is there is this change from when you put software into your health system, where as a patient, oftentimes what they assume is this isn't some separate thing, GetWell, it's just part of Legacy Health. Mm-hmm. And so one of my questions is, when you're using, students and you're taking some of that accountability off of the nursing staff, how do you also make sure you're not kind of letting them go, in a sense, to say this is still something that's core to your job, and we want you to be really good at and adopt, by giving almost like a way out if you have a dedicated role or someone else that's kind of doing that in this sense?
We are really hoping that we're keeping the nurses engaged, because I tell them every day, you are the one responsible for the education with that patient. You have to still go in and do that teach back component with the patient, the assessment of what they learned and where they need to go from here. I am also so hopeful that our nurses will see, when they're visiting those patients and doing those teach back moments, that how much time is saved just from the patient watching the video. I tell nurses all the time, I'm like, so you need to teach crutch walking or wound care. The patient watches a 2 to 5 minute video on that. You come in and you do your teach back, return demonstration, and you just saved yourself 20 minutes. Half the time you don't even have to assign it, because I'm working hard to take that off their shoulders as well and assign as many videos based on orders as I can. I'm hoping they catch the infection as we go around. Legacy, prior to me, has retrained and retrained and retrained our nurses. And when I first came in and looked at our utilization, I said, we need to retrain our nurses. This is not working. And they're like, we've done that. And so I said, let's think outside the box. Let's get this message to them in a different way. If they are so busy they don't have time for this fluff, let's show them how this fluff can impact their day in a very positive light.
Wonderful. Well, I think that's the
I'm
end of
blinking
today's.
now.
Yeah, she's
Please
blinking.
contact me if you have any other questions, or Ashley, we're happy to provide you any training materials. We're happy for you to take this out to your organizations in any format that you want, if it works for you.
Perfect. Thank you so much.
Thank you.